We'll get going here in about a minute. I haven't seen the mayor pop up yet. We'll wait just a sec here.
I'm here.
Oh, you're there. There you are. Okay. We'll give it not quite 1:15, give it a few more seconds. Okay, it is now 1:15, so we'll go ahead and get going. Welcome again to our weekly news conference dealing with all things COVID-19 pandemic from the city of Bloomington, Indiana University Health, and Monroe County. As with us always is Mayor John Hamilton, and of course with him as well will be Monroe County Board of Commissioners President Julie Thomas, IU Health South Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU's Assistant Vice President for Strategic Partnerships and the IUB COVID Response Team Unit Lead, Kirk White. We will begin with some opening comments. We'll start with Mayor Hamilton.
Thank you again, Chuck, for organizing this, and thank you for all attending. Just quickly, we'll announce we did have another COVID case positive diagnosis in city employment at a Bloomington Transit driver. We're following all the protocols as we continue to announce those and wish them well. I'll also report the City of Bloomington Utilities is continuing their steady wastewater monitoring and informing that to the health experts. Again, I'll note that that's an experimental effort that will be fully reported on in a few weeks as the scientists and the data analysts can bring the level of sophistication to that they need. But I do want to report that the City of Bloomington Utilities did note in the last week's data a rise noticeable in the detection of the overall viral presence in the wastewater at both wastewater plants, and in a couple locations generally in the city. They are not sufficient to send off all the alarm bells, but they are such that we talked about them on Wednesday, and we'll be continuing to monitor those regularly with the health experts at IU and with the Department of Health and IU Health and others. So I just wanted to note that it's not shocking that we've seen a little bit of a background rise, if you will, and that's going to help make sure we keep our attention high as we've seen some of that rise. It also reminds us to be very attentive to and concerned about increasing activity, social activity. Of course, there's a football game that IU is very carefully monitoring, but that can be an occasion for gatherings, and we're going to be attentive to those and continue to remind people that inside the city you should not gather. It is against the regulations to gather in groups of more than 15, and even when you do gather in groups of 15 or smaller as private social gatherings, you need to be distanced and masked to protect each other. We sent a letter from mayors of the Big Ten to the Big Ten Athletic Conference, just noting how important the collaboration is, and I sincerely appreciate the great collaboration we have here locally. We just have to keep doing what we're doing and use common sense. I'm just going to close by noting that the statewide data is very concerning. You'll hear, I know, data from our local experts that things are pretty good here. We're continuing, we see some trends, but the overall trend is positive. But we have to stay very attentive because the statewide trend is not good. And again, I'm not the health expert, but I think it's important to note this publicly available data. The 7-day moving average of new cases, that's a smoothed out the curve, 7-day average of new cases in the state was running around 800 or 900 in August and September, both of those months, 800s or 900s for the 7-day moving average of new cases. It is now over 2,000, that 7-day moving average. Let me say that again. It was 800 or 900s per day, new cases in Indiana in August and September. It is now over 2,000 per day as a 7-day moving average. That's not driven by dramatically changing testing amounts. The daily deaths in the state of Indiana hovered around 10 or so in August and September. It is now 24 7-day moving average of deaths. So these are really significant negative trends in the whole state. It reminds us how important it is what we're doing here, the local efforts that we've made, even with the big student rise that did show new cases here. We've seen a regular decline since that, but we really need to pay close attention because what happens around us affects us. So thanks for all you're doing, and I'll be happy to take questions. Just reminding people that this virus is very active in the state of Indiana, and we need to keep doing what we're doing in Monroe County and Bloomington to try to protect each other. Thanks.
All right, thank you, Mr. Mayor. So next go to Monroe County and talk about the Monroe County numbers. Penny Cottle, if you want to go ahead.
Certainly, thanks, Chuck. In terms of the numbers, and locally today, our positivity rate was 3.7%. And while that may seem low, that is an increase and a bigger increase than we've seen. You know, in the past week, we have hovered around that 3% mark, and 3.7 is a bigger increase. Now, in looking at that, we've had some days where the positivity rate for that particular day was higher than normal, and that will help drive some of those individual numbers. But we should not think that this virus is not in our community, because it is. And when you look around the surrounding counties, you know, 3.7% may not seem high. It's not, at this point, a red flag, but it's going up. And when you look at our surrounding counties, most all of them are over 10%. So it is very important for us to think about that. And, you know, county lines, we cross county lines every day. People travel back and forth to work, to play, for medical care, all of those things. And so we have to not just pay attention to what our numbers are locally in our county, but what they are around us. And in the state, counties surrounding us, they are going up. We are seeing cases in our community. It's not just on campus. I know we've spent a lot of time over the past month kind of talking about the university and numbers, and but we are seeing community cases. And so I don't want anyone to think that there are not cases just in our community. What we are not seeing cases transmitted in the classrooms. We are seeing cases spread through social gatherings, people, and not necessarily large social gatherings, but people letting their guard down. And this really isn't the time to do that. We have the power to change things and to keep our numbers lower and to keep them lowering as opposed to rising. Being positive does not mean that we have to ignore, that we are ignoring the negative, but being positive means that we are overcoming the negative. I saw that as kind of a thought for the day, and I thought, wow, that really kind of hits home. I believe that we can acknowledge the seriousness of this pandemic and still remain positive. We have tools to reduce transmission. This is, we talk about them every week, and every day we're sending out messages. Prevention is key to lowering the transmission of this virus. 6-foot distancing, maintaining that as best that we can. Make sure that we are wearing our masks and that we're wearing them appropriately. Avoiding crowds, and crowds of any size, especially crowds of strangers. Staying home when we are ill. And that illness, when I talk about that, it's whether you have influenza, whether you have COVID-19, whether you have some other respiratory infection. Stay home if you are sick so that you are not spreading that we are not taxing our healthcare system from any of those viruses. And it can be very difficult sometimes to know the difference on the surface. So staying home when we're ill is important. Maintaining good hand washing and good hand hygiene. You hear us talk about these things all the time. These are all tools that we have every day, and we've been talking about them all year long, and we talk about them every year all the time because they are good measures. The masks and the 6-foot distancing is what's kind of changed this year from other years, but those are prevention tools that we have right now. And as we come into the winter months, we start to come inside more, whether that's watching the games that are on television or whether it's a gathering of family. We're going to be indoors more, and so we can add making sure that we have good ventilation, whether that's opening some doors or windows, cracking them, getting some airflow inside, but also the use of vaccines. Get your flu shot now, and when the COVID-19 vaccine is available, make plans to get that vaccine as well. We are planning to distribute it. We're making plans for that. We've had pandemic flu plans. We're using those plans to prepare for that vaccine distribution. So we do need to stay vigilant, and with our prevention actions, avoid making yourself a close contact and avoid making somebody else a close contact to you. Every day we continue to learn the vaccine is coming. Please answer the call from the contact tracers if you are positive or you are getting a call because you may be a close contact. Please cooperate with them fully. Going into quarantine is not a failure. The trick is if you go into quarantine and you do not become infected, then that's a good thing. It means that your prevention strategies like wearing a mask worked. And if you do become positive, it means that you are not transmitting that infection to others. And so you're slowing that spread. And my final thought would be that positive actions combined with positive thinking results in success. So let our positive actions and thinking as a means to reducing or smashing the transmission of COVID-19. Thanks, Chuck.
Okay, so just to keep everybody on your toes, I'm going to mix up the order a bit this week. Kirk, Penny referred to the IU results. Let's go ahead and talk about those. It was good again this week, but where are we?
Thanks, Chuck. Yeah, the general trend this week on the campus has been good. In our Greek system, we went from a 1.5% mitigation testing positive rate down to 1.3. In the residence halls, it went from 1.1 to 0.6. And the Greek system live-outs went from just a little bump up from 2.5 to 2.7. But overall, off campus went from 0.8 to 0.5. So in general, we did pretty well that past week, and our 7-day prevalence rate for mitigation testing is at the 0.6 level, rolling average across the university. So things have really done well. We have started processing mitigation testing at the Bloomington campus in our own lab. So that has slowly started this week, and we're going to get up to full speed with the, we have been processing about 10,000 tests a week, about 10,000 mostly students and some faculty and staff. We will eventually get up to the point where we can test 35,000 a week, which of course that's system-wide, but most of that in Bloomington. And we feel like this will really up our game in the ability to find where outbreaks are and get them under control in a hurry. Switching over to flu, flu vaccines are going well as well. We remind our students, faculty, and staff that that's a requirement that they have a flu vaccine. And our next two mass clinics will be on October 28th from 6 a.m. to noon, and then on October 31st next week from 9 a.m. to 3 p.m. And both of them are at Simon Scott Assembly Hall. And you, of course, can make your reservation for a time block by accessing the internet and using your common access card. I also want to mention, of course, we know that tomorrow is the IU football game. Will be kicking off at 3:30 against Penn State. There will be no tailgating at the stadium or in the lots around it, consistent with our policy of keeping groups to very small levels. And of course, that's a Big Ten policy as well. But we want people to still be able to follow the game, enjoy the game. There's still plenty of opportunity to do that. It'll be on Fox Sports 1, broadcast on the IU radio network, and of course on Sirius and XM. So in the chat box there, I'll put our tips for home gating and positive ways that that you can tailgate at home and still celebrate. We'll have some things going on campus, socially distanced as well. There will be actually a tailgate trail from the clock tower to various watch parties, and we'll be making those done as safely as possible. There's some good recipes on there, and we encourage people to enjoy things that way in a safe way. We're also working on departure testing. So that week of November 16th, the week before classes end for fall semester, we realize that many of our students who will be traveling home would like to know if they by chance have any culture in their virus in their system, and this will allow them to get that test. We're going to do those before they leave. So be watching for plans on that. You'll be able to sign up and get mitigation testing. And we're working on some documentation on that, because we know there are some, because of the prevalence rate in Indiana, probably not because of the prevalence rate in the campus or in Monroe County, but because the rest of the state's on a bad list in many places. Some of our students who are leaving will need some sort of certification that they've tested recently within the last couple of days in order to avoid a 14-day quarantine at their final destination. So we're working on that as well, using our own testing facilities and documentation. Well, that's my update for today, Chuck. Thank you.
All right, thanks, Kirk. Continuing with the numbers theme, Brian, let's talk about IU Health and what you're seeing.
Yes, thank you. So first of all, thank you to Bloomington, IU, and Monroe County residents for all the great work you're doing to keep our numbers low. It is a beautiful fall day today, and we want to get out and enjoy it with proper practicing of safe wearing of our masks. We'll talk about that later. But across the state of Indiana for IU Health, our COVID-19 cases increase. If you look at the chart on the screen, you can see that we're at our highest level since in April of cases in hospitalizations. across the South Central region. Our Bedford Hospital is full. We are on incident command again at the state level daily and here at the regional level as well. Here in Monroe County, both IU Health Bloomington and Monroe Hospital have seen some increases. You see a quick dip there, but continuing to see more here. And remember that this is a turning of patients. So while this is hospitalizations as of a given time, there are others as we discharge them. So these numbers are a little higher than the total number of inpatients that have been seen. So I want to move on to visitor policies. On Tuesday, we announced that we are moving back to not full guidelines of no visitors, but to a little more restricted in our guidelines. And so this change is due to the positive numbers of COVID-19 in the area. So only one visitor per patient will be allowed per day, per 24-hour period. We've been allowing one visitor, but that visitor could rotate. That is no longer the case because it poses too much of a risk to our patients, our team members, and our community. The new policy means that we are encouraging anyone who is an inpatient or anyone who's scheduled to have surgery and be an inpatient to make sure that they set up in advance who that one person is. That would be their their visitor for that one inpatient stay. And make sure you tell us that when you come to the organization, and we can make sure that all things are facilitated. We continue to have virtual communications, just as we did before. We have iPads and what we call, computers on wheels that can go into the rooms, and loved ones can talk to as many people as they want to talk to over the internet through secured services. And so we do have that available to all of our patients as well. Each visitor will also be screened and given a mask to be worn at all times in our facilities, as we have been doing and practicing all the safety measures that we have been put in place since March. So thank you to the community in advance for your understanding and having to go to this one visitor per 24-hour period policy. And this does align with our IU Health visitation policy that has been in place since June 15th. So let's move to flu shots. We continue to offer several free flu shot clinics across the IU Health South Central region. To date, we have given over 21,000 flu shots in this 5-county area. And by the end of our flu shot vaccine program, we will have given over 50,000 flu shots to this region. And so we are continuing to do that daily. If you do a flu shot, we might just give you a free IU Health mask. So get to any of those clinics. So let's talk about masks. So when we talk about face masks, I'm not talking about the IU football face masks. I just remind you of the game this weekend and practicing safe. I'm talking about the face masks that we wear to protect ourselves. And we want to be sure that we are doing, not only wearing a mask, but wearing them properly. So I am going to demonstrate to you how we do it and how I do it at home and in the community. So first of all, hand hygiene, whether that's washing your hands, it's alcohol-based cleaner, whatever it is. Pick up a clean mask by the individual ties, put it over your face, around your ears, not touching your mask, and then tighten around the nose if that's one you have. And then when you're ready to take it off, grab it by the loops, not touching the mask, pull it off, put it down, and proper hand hygiene again. So that's proper hand hygiene. Do not touch the mask when you're taking it on and off. If you've been in other circles and situations, make sure that you're getting your masks cleaned if they're cloth. Either when they're soiled, they're wet, or if you have used them for the day, they need to be washed, laundered, cleaned, or thrown away and put on a new mask each time. And then finally, we want to be sure everybody has a safe Halloween. We celebrate Halloween this next week, and it is an enjoyable holiday for many of us, but there are so many ways we can do it without the trick-or-treating. And so on our Facebook post, There are some really good ideas that we've posted on all of our regional IU Health sites for how you can celebrate Halloween in a different way this year and make it memorable. So again, put on your face mask. It's going to be a great weekend. It's beautiful. The fall colors in Southern Indiana are beautiful. Get out, get some sunshine, get some fresh air, and wear your mask. Thanks.
I was saying brilliantly as I had my mic muted there that I was trying to share the screen that I didn't share earlier, emphasizing the the flu clinic, Tuesday, October 27th, 1 to 3 from Bloomington Crestmont. There's got to be a certification for operating Zoom available at some point. I have not clearly earned that. Next,
you do much better than I do, so thank you.
Next, let's go to Julie Thomas.
Thank you so much. I think some of the many probably hours of experience you've had would count as certification. So just a couple quick notes. The county has set Halloween hours 6 to 8 p.m., but please follow the guidance on our website, co.monroe.in.us, including a list of fire stations that are participating in safe Halloween activities for families. Please note that early in-person voting continues, and that's at 401 West 7th Street. We've had most days averaging over 1,000 voters a day. I personally waited an hour and 45 to vote, and it was worth every moment. Everyone was in line, was wearing a mask. We were standing 6 feet apart. So it was really heartening to see that, and we really appreciate that the voters are doing that. But if you arrive without a face covering, one will be provided for you. Please note that Saturday voting, in-person voting, begins tomorrow, 9 to 4. If you have any questions or need any assistance or information, go to indianavoters.com or monroecountyvoters.us. Just a note again that we are providing funding from CARES money from the federal government through the state. We are providing CARES funding as grants for local businesses and social service organizations for COVID-related non-personnel expenses that have not already been covered by another funding source. As of yesterday, our total granted to businesses and social service organizations was $180,217. And we've also granted about $15,000 to local taxing units that did not receive CARES money directly. So if you need information on that, we've increased the cap to $20,000 per entity. Please visit co.monroe.in.us. Also, for residents who are facing evictions or utility disconnections, please contact your township trustee as soon as possible. As of last week, we had reports of $39,000 in township assistance funding from the county, from CARES funding to the township trustees who are ensuring that people remain in shelter with their utilities connected. So please contact your trustee for information. The sooner the better. Every county resident has a trustee. Also, just a quick note and reminder to please get your flu shot, and also to please continue to wear your face coverings. It's really important that we maintain the best possible environment so that our economy can recover well in the future, but we need to keep Monroe County residents healthy. Do it for others, don't do it for yourself, but it's also a great thing to do for yourself. And please get your, and again, please get your flu shot. And I will say that we may be really tired of COVID. I know most of us are, I'm sure all of us are, but COVID's not tired of us, and it's still out there and it's increasing. So please keep that in mind, be vigilant, don't let your guard down. Thanks everyone.
Okay, and lastly to Allison Moore.
Thanks, Chuck. I'd like to mention our dates for our blood drives that we have remaining. We have a blood drive scheduled for October 28th from the time frame of 2 to 7. There is one spot still available. If that date works for you, go to redcross.org and check out the time slots that are there. And like I said, there's one. Hopefully that one time frame would work, and then that drive will be fully scheduled. And so we also have a November the 9th date scheduled. It's from the hours of 10 to 2. Both of those drives will be held at the Monroe County Convention Center, and I'm very thankful and appreciative of them for getting these drives going, because that 2 to 7 time frame in October is super close and probably will be fully scheduled by the 28th. We will be opening an evening time slot in November, like I had announced last week. And so by next week, we should have that date secured, and we'll be able to announce the 2 blood drives that we then have in November. And then again, we'll have 2 additional, a daytime and an evening time, ready and scheduled then to follow in December. I'm excited to announce that I received right before this phone call some information from the Red Cross, where they let us know that our blood drive, our collection site, because of the success that we have had, is the top 3rd collection site in the state of Indiana and the top 35th in the nation. So great to those people here, right here locally, that have been able to contribute to our successful drives and have us ranked at such high prestige. And I'm excited to be a part of those wonderful statistics. And lastly, I just want to let everyone know that tomorrow is Make a Difference Day. And I know, like Commissioner Thomas said, we're quite over COVID, but COVID, unfortunately, is not quite over us. And it takes us all to make a difference and try to keep our numbers smashed, and all of us to do our part. So I encourage everyone tomorrow and every day to make a difference and be respectful of others and follow all of the guidelines that we have in place. That's all I have, Chuck. Thank you.
Okay, we'll jump into questions. First one for Mayor Hamilton. At a previous news conference, this is from the B Square Beacon, you said Bloomington's wastewater COVID detection data would eventually be released publicly. Could you review the timeline for the planned release and also the reason for not just releasing the data as it becomes available?
Sure. Thanks for the question. And yes, I know it is a little frustrating for all of us that this data that we are collecting isn't just released directly. Frankly, it was a condition of participating in what is a relatively experimental effort that the state is helping coordinate and even fund with university support, a few cities trying this. And one of the conditions was that this not be data that was released, I think primarily because the science behind it is just not secure yet. And the scientists and those who have helped develop the system that we are implementing have indicated it is not to be released. So that's kind of the basic outline. It's experimental, and we're really glad to be doing it. I have said, and we have said, to the extent that there are indicators in the data that can be helpful to the health experts, the health officials who are trying to assess what's going on and measure what is happening in the community. We are sharing those with the health professionals, and will continue to do so. And even this week, I did share what I mentioned were some background level detections that were rising. So it helps us keep our eyes on what we ought to be watching out for. In terms of the timing of the release of the data, ultimately, it is weeks out. I don't know exactly. It's not really in our hands, but the overall project to do this, I think, runs a few more weeks. And then they'll be assembling the data from Bloomington and a number of other sites, and we'll be quality controlling it and trying to understand what it can tell us. And when we are told we can release it, or it may be released system-wide, I'm not sure, but it won't happen imminently, but I think I expect yet this year it will happen. So that's where we are, and happy to answer more questions about it.
Okay. Question from WTIU, WFIU. This one, and I've just lost the thread here. This one for Brian Shockney. Here it is. Again, the Zoom certification needs to come quickly.
Oh, you're too hard on yourself.
What are the capacity numbers for bed space in Bloomington?
Thank you for the question, and like the mask, by the way, the white mask was good. Good demonstration on screen. So thank you. So we have, right now we're over 200 patients on a consistent basis in our hospital. That includes our mothers and babies as well in NICU. We have more capacity, but the issue here is really around the beds that a COVID positive patient requires. So because of the isolation, and then those patients who may be symptomatic until we get their test back, they require a private room instead of a semi-private room. So it really is 3 times a day, well, continuously, but 3 times a day, we're huddling to see where those test results are and how many people we can move into semi-private rooms, who we can transfer. But then there's a bigger picture, and the bigger picture is the IU Health system, regional and system. So as we continue to decompress Bedford by taking some of their patients, Paoli has been able to take some of the Bedford patients. And then as a system, as we saw the East Central region of IU Health increase in the Muncie area over the past several weeks, they've been able to decompress with the larger system at Methodist Hospital, and that is also an option for us as well if we get to that point. So that's the beauty of the larger system, but it's not so much the number of beds that are available, it's the types of patients that are in those beds. And so at this point in time, every year, we're trying to get those last minute surgeries in, right? So everybody wants to get them in before their deductibles. And so that on top of when we add the COVID patients and the isolation requirements, it really taxes the system and requires us to hold back on some of the surgeries that, quite frankly, patients are wanting to get in. So it's a chess game and it's a puzzle, but capacity right now we're doing well, but that's just Bloomington Hospital. As I said before, we're having to decompress Bedford every day.
Okay. Question from Eric Berman at WIBC for Mayor Hamilton. And the second part, Kirk, I think might be something you could chime in on. First of all, regarding the mayor's letter to the Big Ten, what, if any, response have you received from the conference? And the second part, why does the Big Ten need to set a metric for when positivity is too high as opposed to the county or the state setting its own?
Thanks. So far as I know, we have not yet received a formal response from the Big Ten Athletic Commission. This is a letter sent from most of the mayors of the cities of Big Ten universities, just to summarize for folks, that basically encouraged and affirmed the collaboration that's been in existence and looking forward to that, but also asking a couple things specifically. One was to try to identify not just university-based metrics on when football games would be appropriate, but to work with communities to develop community-wide metrics in terms of health and COVID spread that would be indicative of when a football game, such a gathering, would be appropriate or not. And then secondly, really essentially to try to have as few night games as possible. We haven't gotten a response so far as I know. It's possible that went to some other folks. We continue to work very closely with IU on this and appreciate the thoughtfulness. I think the idea of the metric is simply to say that even if in a circumstance, I don't know, but Bloomington is maybe different from Columbus, Ohio, or certainly in Chicago area for Northwestern, but if there are city community-wide metrics that may be as important and informative of a decision like that as just university-based metrics, and we're continuing to talk about that. It's kind of a week-by-week situation, and I'm happy to have Kirk weigh in too. But look, these are complicated choices, part of that multidimensional thermostat I talked about that we're trying to dial, and we appreciate the continued collaboration on this.
Chuck, I think the Big Ten's taken a good step here. I mean, you always have to balance a broad metric as opposed to one that best fits for a community. But I think we've seen in this pandemic that following the best advice of scientists, and the Big Ten, of course, has the resources to call upon some of the best scientific minds in the country. They look at what they want to have as a uniform guideline for all teams and communities at a minimum. I'm sure they wouldn't, well, I shouldn't say that, but I doubt they would object if we had even tighter restrictions. So I think the concept they have is to keep it uniform across all playing fields in all the cities the Big Ten plays in.
Okay. Question from the HT for the city/county/IU. Is there a plan in place to deal with a possible surge in issues with restaurant capacities or private events or parties in light of tomorrow's game? Don't know who wants to jump in first on that one.
I'll jump in. We'll just go on. I'll see the order. City, county. Let's try that. Let me just be really clear to the public. You need to be careful. We all need to be careful. As Penny Caudill indicated, it appears to be that social gatherings are a very possible source of spread of this virus. And the fact that we're having a football game does not mean the virus is taking a weekend to relax. And any gatherings should be done with great care and with consistent with all the guidelines that exist. So first of all, that message needs to be clear to everybody in this community. It's up to us. Our behavior will determine this. Second, I will say, yes, we are on quite heightened engagement and alert to monitor both establishments, restaurants and bars, as well as private gatherings tomorrow and through the weekend. We continue to appreciate tips. If people think there are big gatherings that shouldn't be happening, please let us know. We can put the number in the chat room again. And lastly, I'll just say, look, we are collaborating very well. County Health, City, IU, county offices are all working together to try to continue to do what we've been doing well in Monroe County to tamp down the virus. But this is a challenging weekend, and it'll be important. And it is possible, if behaviors aren't good, that we will see a rise that will cause us to have to impose some other restrictions. We hope that won't be the case.
Yeah, so just going in order, I suppose the thing that I would add, yes to everything that the mayor said, and I would just add that we will follow our processes, that, you know, we have processes in place for complaints and non-compliance that can include fines. That's never our first intent, but if it comes to that, we can certainly use those other options if we need to. But again, each and every one of us needs to do our part. Each business needs to do their part. And together, if we each do that and act responsibly, we will get through this without a rise in cases and transmission. We just need to be cautious and protect one another.
Chuck, I just echo the mayor's and Penny's comments. Everyone needs to remember that we are in a public health emergency still. This did not end overnight. It's not going to end because of when we kick the football. This is an emergency. It's one like we've never seen in most of our lifetimes, and hopefully we won't again. It's very serious. And we do not want to fill up Bryan's hospital. There's no reason to do it. And we don't want to be in a spot like that. And so I don't have any problem saying the mayor and I, you know, are in sync on this. I'm sure as our provost and other leaders, Bloomington Police, IU Police are working closely together, and they don't have any problem helping enforce what the emergency orders are. In addition, members of the Alcoholic Beverage Commission in this county are keeping an eye on these situations as well. Irresponsible activity will not be tolerated. We just can't have it. There's too much at stake. And we don't want it for the campus. We don't want it for the community. And we're serious about this.
And Mayor Hamilton post up the number for reporting violations is a non-emergency police 24/7 number. That's 339-4477. And speaking of numbers, we had a question that came in on Facebook regarding if I get a phone call for tracking, how will it show up on my iPhone? And those of you who are watching on Facebook and elsewhere, that would show up as IN Health COVID, COVID, caller ID number 833-670-0067. The text would be from 877-548-3444. Now, for IU, Kirk has posted up here, the IU tracing team call will likely come from an 855 number, 812-855-0042. So those are the numbers to look for if you are getting a tracing call. So that is our questions that we have for this week. We will again be back next Friday. We always have something to talk about. As long as we've been doing this, we'll be back at 1:15 next week. Appreciate everybody being here this week.
Be safe.
Chuck. Thanks, everyone.